Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Participant student, you are welcome to second presentation for Biology SS3, second week under the umbrella of id extension program powered by Exponential Computer. I'm still remain Nuruddin Sani here with you to present on the concept of kidney as one of the homeostatic organs. First of all, we'll talk about structure and function of the kidney. Kidneys are two dark red bean-shaped organs, meaning that each of every individual organism possesses two kidneys, and they appear bean-shaped and they appear physically as dark red in terms of their color. They are about 11 centimeters long, 6 centimeters broad, and 3 centimeters thick. The weight of each kidney is 150 grams, but the measure here, 150 grams, we are referring to healthy adult person's kidney, not that of the baby, because biologically, whenever we are to cite weight or size of a particular organ, we take reference from the adult individual. They are located at the back of the body cavity, just below the stomach, one on either side of the back, meaning that the two kidneys we have, they are located left and right in the lower abdominal cavity, dorsoventrally situated. Dorsoventrally situated. That means they appear to be within they are neither ventral, neither dorsal. That is what we often refer to as dorsoventrally situated. The left kidney is situated slightly above the line of the right kidney, meaning that the left kidney is relatively higher than the right kidney. The kidneys receive blood from the feared renal arteries. See the diagram below, we will see it. Blood exits into the feared renal artery, meaning that blood from the dorsal aorta is transported to the kidney via a pipe known as renal artery. And then when this blood is filtered by the kidney, which is one of the major functions of the kidney, the filtered blood exits or leave the kidney via a pipe called renal vein. Each kidney is attached to the ureter, a tube that carries excreted urine to the bladder. So these 3 points, when blood from the dorsal aorta or blood from the body is transported to the kidney, this blood contains useful and unuseful materials and it carries urea. So when blood enters the kidney through the renal arteries, the kidney functional unit, which you often refer to as nephron, perform the function of filtering the blood and remove the urea from the blood, filters out urea from the blood. The filtered blood, which contain no urea, will pass through the renal vein and go back to the rest of the body, pass through the renal vein and go back to the rest of the body, while the filtered urine will now move to the collecting ducts, passing through the ureters and get to the urinary bladder. Each kidney is attached to the ureter, a tube that carries excreted urine to the bladder. The nephron is the structural and functional unit of the kidney. So these nephron, they are the ones that perform the function of filtration or filtering the blood. Each adult kidney contains around 1 million nephrons. The nephron utilize 4 processes to alter the plasma, to alter the blood plasma, which follow to it. These processes are ultrafiltration. So ultrafiltration is the process by which the larger molecules or the larger materials or materials with larger molecules pass through the glomeruli of the nephron into the Bowman capsules and to the tubules of the nephron, while it is a process whereby larger particles remain on the surface of the glomeruli while the materials or substances with smaller molecules pass through the glomeruli and get into the tubules. That is what I mean. Then selective reabsorption. It is a process whereby usable materials to the body that has already have smaller size molecules which pass through the glomeruli and get into the tubules are selectively reabsorbed back to the body fluid. Then tubular secretion. This is the point whereby certain hormones are being released into the nephron to ensure effective function of the nephron. And there are two hormones secreted here. There is vasopressin, which we often refer to as antidiuretic hormone, which regulates the amount of water in the nephron, and the excretion. This nephron, at the end of it, in the nephron, ensure the excretion of dilute urine out of the body of an individual organism. Looking at this is the internal structure of the urinary system. This is what we call the dorsal aorta. It comes directly from the hearts. It carries blood from the hearts and it branches into the two kidneys. This is one pipe called the renal artery, and renal vein. This is the upper one is the renal artery. The downward is the renal vein. So this dorsal aorta, when it carries blood from the heart, part of the blood containing what? Containing usable and unusable material, and also containing the urea. It passes through the upper pipe here, which you often refer to as renal artery, and get into the kidney. In the kidney, this blood is filtered. When it is filtered, the already filtered blood will now pass through the renal vein. This is the renal vein, and pass through the superior or vena cava. This is what you call the vena cava. It will now carry the blood back to the body. Then the filtered out materials from the blood, excess water, the urine, will now pass through this pipe, which you often refer to as ureter, and it will be transported down to the bladder. And this bladder, from time to time, both left and right kidney, they will send their urine content into the bladder. When the bladder reach a threshold, there is sphincters controlling the opening and closing of the bladder or exit of the urine. So when the amount of urine in the bladder get to a certain level, so the sphincters will now relax, causing the urine to be emptied out via the structure often called the urethra that pass through the penis in the male, or that pass through the clitoris of the female. Here is the internal structure of the kidney, how it looks like. This is the renal artery. When blood comes from the dorsal aorta, it now passes through the renal artery and gets into the kidney. These are what we call medullas of the kidney. Inside each of these medullas, there are thousands or millions of nephrons. Thousands or millions of nephrons. And these nephrons are the functional unit of the kidney that ensure filtering of blood and formation of urine. So when blood carrying urea and other waste products pass through the renal artery and get into the kidney, and this renal artery, it branches rapidly into each medulla of the kidney. And in each medulla, it will now branch rapidly up to the number of nephrons present in the medullas, carrying blood to each nephron, thereby enabling the nephron to perform the function of filtering the blood. As blood filtered out, so there will be the filtrate and the residue. or we can say there is usable content of the blood, filtered blood, and then the particles removed from the blood. So the filtered blood will now leave the nephrons, passing through the renal vein and go back to the rest of the body. While the filtered urine out of the blood will now pass from the nephrons, passing through the ureter, and this ureter lead to the urinary bladder, where it will deposit the urine there. These are the calluses of the kidney, and then the outer zone here is what we often refer to as the cortex. Function of the kidney: they convert a precursor of vitamin D to its active form of calciferol. There are precursors of vitamin D. So kidney convert these precursors of vitamin D to form the vitamin D itself. Synthesize the hormone erythropoietin and renin. Erythropoietin and renin. Excretion of nitrogenous waste, urea, elimination of toxins, excess drugs, maintenance of acid-base balance, meaning that kidney maintain the amount of acid and base in the body, thereby maintaining them to the narrow limit often required by the body. Elimination of toxins, toxic substances. When an individual takes poisons, it is the kidney that will now react to ensure excretion of that toxins, excess drugs. That is why when someone takes amphiculus, not all part of the drugs will be absorbed by the body of an organism. Some part of the drugs will be excreted via the urine. So that is why when an individual takes amphiculus during urination, he will now perceive the booming or the odor of the amphiculus coming out from his urine. Excretion of nitrogenous waste, that is urea. It is the kidney that is charged with the responsibility of excreting the urea. Then regulation of water content in the body. The kidney maintains the water content of the body to a constant level. Regulation of amount of hormones in the body. Hormones in the body need to be regulated. So it is the kidney that regulates the amount of hormones. Because certain hormones, if they are too high in the blood, there is a problem. If they are too low in the blood, there is also a problem. So when there is no problem until when the level of such hormones is maintained at a narrow limit. So kidney performs series of functions in the body and is one of the vital organs that ensure homeostasis. Condition affecting the performance of the kidney. Under certain conditions, a kidney may cease to performing its function. The following are said to be the factors affecting the functioning of the kidney. Excessive drug abuse. So if an individual is abusing drugs, such drugs must be filtered out by his kidney. So the kidney will work day in, day out, tirelessly metabolizing drugs. So in the process, the power of the kidney is going down. So the performance of the kidney will be low. Excessive exposure to some X-ray and radiation. So if an individual is being exposed to X-rays and radiation, this radiation and X-rays, when passing through the body, they tend to destroy some of the functional unit of the kidney, particularly the nephrons that perform the function of filtering the blood to ensure cleanness of the blood in the body. Change in the environmental temperature. So if you look at it critically, you will realize that during the hot season, an individual drink more water but pass less urine. But during the cool season or harmattan season, an individual take little water and pass large volume of urine. So change in temperature for affect the performance of the kidney. The reason or the rationale behind this this phenomenon: during hot season we drink more water, but we pass little urine. This is because most of the water from the body during the hot season, excess water are being excreted via the skin in the form of sweat. Excess water are excreted via the skin in the form of sweat. But during the harmattan season, both the excess water and the urine must pass out through the kidney, because during harmattan season the temperature is so low. Therefore, we do not perspire, we do not sweat. So during the hot season, sweating now carry most of the water together with the urine and excrete them out of the body Change in the normal habitat of the organism. For example, now when an individual moves from maybe a area where the temperature is low and get to an area or environment where the temperature is high, so there will be change in the urine volume pass out of the body. Then disease attack. If the kidney has any disease, so it affects its performance. The volume of urine increases. Brown, red, or purple urine. So the urine color from colorless. Normally urine is supposed to be colorless. So it will be changing. Once urine is changing from brown to red or purple urine, it's an indication that there is a kidney problem. Pressure. When you make urine, you feel some pressure when you are passing urine, as if something is placed on the bladder. Feeling some pressure when passing urine, it is a sign of kidney disease. Causes, symptoms, effects, and remedy of kidney disease. So we are going to study 4 diseases of the kidney under this table. So the first disease is what we call kidney stones. What are the causes of these kidney stones? Accumulation of undissolved calcium salt, accumulation of undissolved uric acid, low intake of water. So when an individual is not taking water in abundance or in sufficient quantity often needed by the body, so this will cause inability for calcium salt to dissolve, and this calcium salt will continue to build up and form stones that may end up blocking the urine flow. These stones can be formed in the ureter, they can be formed in the calluses of the kidney, they can be formed within the a point at a junction between the calluses and the ureters of the kidney, first part of the ureter. So it may appear in the upper ureter or lower ureter, thereby blocking the urine flow. Uric acid also need to dissolve in water. So if an individual has low intake of water, this uric acid, instead of it to dissolve, it will now crystallize, forming stones. So as such, we will have calcium salt stone, uric acid stones, and we have so many types of stones. Symptoms of kidney stones: inability to pass out urine normally, presence of blood cells in the urine, a lot of pain within the kidney area. These are the 3 symptoms. So you may experience pain in the lower kidney, the lower abdominal cavity. That means dorsal-ventrally. If it is a right kidney, in the right. If it is a left kidney forming the stone, then you will feel pain in the left. So effect of kidney stones. So blockage of the urine flow. Therefore, instead of urine to pass out, so the stones will now block the area where the urine will flow. High blood pressure. So there will be high blood pressure in such a person having kidney stones. So what are the remedies for kidney stones? Surgical removal of the stones, avoiding excess intake of calcium. A lot of water should be taken. Reduce the intake of proteins. Drugs taken. Take drugs. Certain drugs like topsilocil should be taken to ensure dilation of the ureters, thereby increasing the possibility of the stones to drop down into the bladder, and possibly if they are not much bigger, they can be flushed out via the urine. Another disease of the kidney is what you call Gulabirullah Nephritis. And the real causes of this disease is streptococcal bacteria. This streptococcal bacteria, when it gets into the system of an individual organism, it does nothing but to increase the porosity of the glomeruli, to increase the porosity, the size of the glomeruli, part of the nephron, part of the functional unit of the kidney that serve like a sieve which filters blood to remove the waste product from the blood. So it will increase the porosity of the glomeruli. The increase of the porosity of the glomeruli, larger molecules which will not pass through the glomeruli can now get access into the kidney tubules. And these larger particles like the blood, and it will now make it possible for the blood to get into the urine. So symptoms: presence of blood in the cells in the urine, presence of amino acid in the urine. So blood and amino acid, their molecules are larger. So if the glomeruli is intact without the streptococcal bacteria increasing the porosity of the glomeruli, these blood cells and the uric acid cannot pass across the glomeruli into the kidney tubules. So therefore, these bacteria will now increase the size of the holes of the glomeruli, thereby giving the chance to blood cells as well as the uric acid to pass into the glomeruli and get into the kidney tubules. So one of the effects of glomerular nephritis: weakness of the body, fever and pains, inflammation of the kidney. That is, when we say inflammation of the kidney, inability of the kidney to perform its function as expected. So remedy: taking correct antibiotics. If you go to urologists, they will give you the correct antibiotics that will take care of the streptococcal bacteria in the body. Use of dialysis if the situation persists, and then kidney transplant if the situation becomes severely critical. The next disease of the kidney is what we often call dropsy or edema. What causes this disease? Accumulation of large amount of water in the tissue. So this edema, it may be disease edema, and we have also conditional edema. In pregnant human, that their body organs become weak at the late pregnancy, their kidney was unable to, or their Bowman capsules, the cells of their Bowman capsules of the nephron were unable to reabsorb water from the body tissue into the nephron, thereby increasing the volume of the urine. So inability of the cells of the Bowman capsules to absorb water from the entire body, it will now make water to lodge into the tissues, thereby causing swelling of the body. And then there are some people that are having disease edema or dropsy, which is not due to pregnancy, which you consider it as disease, not conditional or edema, like what is obtainable in pregnant human, in some pregnant women. So edema is accumulation of water into the tissue, causing swelling due to inability of the cells of the Bowman capsules to reabsorb water from the tissues. So symptoms: swollen ankle, poopy pace, and then effect of this disease is increase in the volume of the affected tissue. Then the remedy: reduce the intake of water, kidney transplant, seeking medical treatments. And then the last diseases we are going to talk about here is diuresis. Diuresis, one of the causes of diuresis: low stroke absence of ADH. ADH stands for antidiuretic hormone or vasopressin. This hormone, its function is to regulate or to maintain the amount of water in the nephron, because this nephron, functional unit of the kidney, their major function is to retain water as well as serve as a channel via which urine can pass to the urinary bladder. So therefore, this hormone prevents water, this hormone ADH or vasopressin, prevent water from joining urine and squirt out of the body and be eliminated out of the body. So if the hormone is not there, an individual cannot retain water within its nephrons. So water will continue to join urine and pass out of the body, and thereby increasing the volume, daily urine production volume. So individual with no antidiuretic hormone, that have absence of antidiuretic hormone, they are said to be having a disease called diabetes insipidus, and this diabetes insipidus is characterized by an individual passing a daily urine production of not less than 10 to 25 liters in a day. The low or absence of insulin. An individual without insulin, meaning that there will be high level of glucose in its blood, thereby making the blood highly concentrated. Then osmosis will take place, movement of water molecules from area of lower concentration to area of higher concentration. So high concentration of glucose in the blood, if there is no insulin to convert it into glucose, the excess glucose will be transported to the kidney and it will be settled into the nephron, thereby making the area of the nephrons to be having high amount of glucose. So the concentration in the nephron will be higher compared to the rest of the blood. Therefore, there will be movement of water from the blood into the nephron. So an individual will continue to pass more urine, more dilute urine. So the characteristics of the two diabetes, this one due to insulin we call it diabetes mellitus, and absence of vasopressin or antidiuretic hormone is called diabetes insipidus. Symptoms: so production of large quantity of dilute urine. Then effect of the disease: decrease reabsorption of water by nephrons, lower blood pressure, and then remedy: reduce the intake of water, improve in the intake of protein, and then taking insulin tabs or injection. But here when we say reduce the intake of water, is we are referring to the people having diabetes mellitus. But for people having diabetes insipidus, they must take water, because water is being constantly being eliminated or excreted out. Thank you for listening. Goodbye. If you have any question, you can lodge your question. Next lesson we will attend to them.